In Massachusetts, 5 people a day are killed by opioids, but the crisis affects thousands more people at a cost in billions of dollars. That's the main point of a new report by the Massachusetts Taxpayers Foundation and funded by the nonprofit Rise Massachusetts. To tell us about the report is the foundation's president, Eileen McAnneny. Thank you very much for being with us.
Thank you, Chris.
I mean, long before you got this report started, we had the fatalities being counted every year by the Mass Department of Public Health, and that was depressing enough. Why do this kind of a study?
Well, I think you really need to quantify the impact in order to begin to manage it and address it. And so MTF, we've heard so much about the epidemic as we talk to employers, as we talk to public officials, as we participate in our own communities. So we wanted to do something that would be helpful. And the Mass Taxpayers Foundation, as you know, Chris, focuses on the long-term economic and well-being of the Commonwealth. And we think that this is a really important economic issue, and so it's why we issued the report.
One thing that struck me is how many of the people affected in a direct way by the opioids crisis are people who have jobs. I mean, these are not full-time drug addicts. These are normal people.
Well, and I think that's why this epidemic is so troubling. It knows no boundaries, socioeconomic or geographic. And so there are a lot of people who are employed who are battling with this substance abuse disorder.
What about the cost to employers as the next ripple here? What does that come to?
Well, depending on how you measure it, but if you're looking at just absenteeism and presenteeism, where you're actually at work but not performing up to par, if you will, that's about $2.5 billion a year. But if you step back and look at the cost to the economy overall, so there are many people who aren't employed, who are not in the workforce as a result, and there are people who have died, and we lose those revenues over the course of their life. And so when you think about it in that way, the costs are enormous.
What about labor shortages? We have tight labor markets. I'm thinking here maybe the building trades.
Sure. I mean, the building trades has been impacted disproportionately by this epidemic, but I think it's true really across the board. In this tight economy, as you point out, there's already a shortage, right? We already have very low unemployment, and there are a lot of jobs that are going unfilled because we can't find folks. And so we really can't afford, as a society and as an economy, to have people on the sidelines as a result of this addiction.
Of course, the other thing going on here is the money that has to be spent on health care, whether it's by people with their own insurance or by taxpayers. What does that look like?
Well, that too is in the billions of dollars, right? And so if you think about the Mass Health program, lots of folks are being treated through Mass Health, and that's already a program that costs the state billions of dollars. And we've added, it's about $1 billion, a little shy of $1 billion to the Mass Health program. But overall in the state budget, it's a couple of $1 billion that is directly tied to the opioid epidemic.
This is BNN News. We're talking with Eileen McAnneny from the Massachusetts Taxpayers Foundation. Eileen, when you're talking about taxes, you're usually saying the state should avoid waste. But how do you avoid waste here and still deal with the crisis?
Well, it wasn't really waste that we were trying to avoid. What we were trying to do is quantify the cost of this epidemic to, again, to help us begin to manage and address it, but also to serve as a call to action to employers, because I think in addition to the societal and health and other impacts, there's a big economic impact too. And we wanted to illustrate that for employers and really for the report and the forum we held to serve as a call to action to get them involved. Maybe they can change their benefit policy or take away some of the stigma and in some way try to begin to address this.
Start with the benefit policy, because I imagine that concerns access to health care and co-pays. What are you thinking about along those lines?
Well, for a lot of people, addiction is a lifelong chronic illness, right? And so it's not like you would get one treatment and be done, or it's for a finite period of time. And so it does require that we design benefits to acknowledge that this is a lifelong addiction. And so maybe it's reducing co-pays so that people can actually get the help they need on a recurring basis. Or it's providing more treatment facilities or recovery coaches that help. And maybe it's not healthcare per se, but just people who are able to help you when you're in a moment of potential use.
You mentioned stigma. This is a state where somebody can be fired for smoking a joint on the weekend at home because they fail a drug test on Wednesday, let's say. I mean, how do you apply that, get over that hump when you're talking about opioids?
I think it's a big hurdle, and I think it requires us to have a different mindset. So when you think about it, a lot of times people who are addicted are actually incarcerated, right? Many times they're jailed either because of a drug conviction or some kind of crime related to drugs, right? And so I think thinking about it as a health issue begins to change that. But I think we have a long way to go.
What about the next step for employers? Because we have groups that represent businesses. Is anybody looking at these reports and saying, let's go do something next to make this better?
Well, that certainly is our next step. We're hoping to convene some employers to have that conversation and see if there are things that they can do collectively, and some of it might be just, maybe it's a public awareness campaign. I mean, I don't know exactly what the next step will be, but I think it's critically important that we get some employers together and have that conversation.
What about the state itself? Should the state be putting more resources into anything at this point than it is already?
You know, I think we certainly, I know in the latest legislation that passed, there were recovery coaches, and that those are folks who help people. I mean, that may be a promising area that we should consider. And it's not a traditional healthcare provider's role, so it is somewhat novel, but I think that that's something that we should absolutely consider, things like that.
We should mention that people want to see this in more detail. You've got that on your website?
We do, www.masstaxpayers.org.
Thank you very much for being with us.
Sure, thank you.
Eileen McAnneny from the Massachusetts Taxpayers Foundation.